Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you part 2 of how the intensive care team is skillfully playing with your emotions if your loved one is critically ill in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to show you how to get an unfair advantage whilst your loved one is critically ill in intensive care. If your loved one is critically ill in intensive care, you and your family are facing some of your worst fears, some of your worst nightmares, and in some instances you are facing your own, as well as your loved one's mortality. It's not a very nice place to be in, and if you and your family are in a situation where you fear for the very health, for the very well-being, and for the very life of your critically ill loved one, I can only encourage you to seek out for support and to do your own research. Even if you come from a closely knit family, having a loved one critically ill in intensive care is a highly emotionally charged situation, and even the strongest of families can easily reach their mental limits during this stressful, challenging, difficult and overwhelming situation, where families of the critically ill tend to feel extremely vulnerable. And it can also be a lonely road, having a loved one critically ill in intensive care. You all of a sudden realize that other people are in control. You experience a sense of loss. You realize that you can't just carry on with your day-to-day life. You realize that something profound has changed in your life, and in an instant, and you realize that if you don't adapt and change your thinking, change your behavior, and also how you look at the situation, if you don't change all of that, you will feel powerless, with no control, no influence, and worst of all, without peace of mind. You also realize very quickly that if your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or if your loved one is even threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or if your loved one is in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one, or worst of all, if your critically ill loved one is approaching the end of life in intensive care. I can assure you that in more than 15 years intensive care nursing in 3 different countries, and after I have literally worked with thousands of critically ill patients and their families, that the challenges and difficulties you are currently experiencing and going through are real. And if you are like 99% of families of critically ill patients in intensive care who have no peace of mind, no power, no control and no influence, you just silently and passively let things happen to you. You quote-unquote suck up to the intensive care team. You don't question. You just take everything for face value the intensive care team is telling you, and you basically don't question. You are at a loss and looking for a solution in this dilemma, and trying to get an advantage, let alone an unfair advantage, is not even remotely on your radar. The intensive care team is managing families of critically ill patients all day long, 365 days a year, and they are used to doing it. And they are used to doing it their way. They are positioned as the experts, and they are positioned as the perceived authority with perceived power. That's how society and how the general public sees doctors and hospitals, So we have to admit that it was us who gave intensive care doctors and hospitals their perceived power status. You probably have already realized that you are in a unique and once-in-a-lifetime situation, and unique and once-in-a-lifetime situations require unique and different responses. Therefore, it's time to look at the solution of the problems at hand. It's time to stop looking what 99% of other families of critically ill patients in intensive care are doing, who have no peace of mind, no control, no power and no influence. And it's time for you to get an unfair advantage. It's time to stop putting up with the intensive care team talking over you and at you, rather than entering into a genuine dialogue. It's time to stop putting up with the intensive care team being unavailable to you. And it's time to stop putting up with the intensive care team talking to you in their medical and academic jargon, rather than speaking to you in a language that you can understand. It's time for you to get an unfair advantage whilst your loved one is critically ill in intensive care. And it's time for you to get peace of mind, control, power and influence. It's time for you to take matters into your own hands. It's time for you to do your own research. It's time for you to get a handle on what's happening. And it's time for you that if your loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or even worse, is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or is in a situation where the intensive care team is suggesting a withdrawal of treatment or limitation of treatment as being quote-unquote in the best interest of your critically ill loved one, or is even approaching their end of life in intensive care, that you don't stay at the mercy of the intensive care team, like 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence. It's also time for you to realize that if you understand that the politics, the dynamics, the competing interests, the power play, the medical research interests, the intrigue, the psychology and the hidden agenda of the intensive care team, that they all have a big influence in how the intensive care team is positioning your critically ill loved one's prognosis and diagnosis. It's time for you to understand that what you see in intensive care is not always what you get. It's time for you to understand that what's happening in intensive care behind the scenes is often impacting on how the intensive care team is positioning your critically ill loved one's prognosis and diagnosis. And remember, the only way you can get an unfair advantage compared to other families of critically ill patients in intensive care is by looking at what they are doing and do the complete opposite. That's right, I have to repeat this because it's so important. The only way you can get an unfair advantage compared to other families of critically ill patients in intensive care is by looking at what they are doing and do the complete opposite. And the good news is that you can also get an unfair advantage when you are dealing with the intensive care team. The good news is that the minute you get informed, you start doing your own research, the minute the intensive care team knows that you are not buying into their perceived authority or into their perceived power, and the minute the intensive care team knows that you are prepared to stand your ground and stand up for yourself and for your critically ill loved one, that's the minute when things will change for you and for your family. The minute you take a stand, the minute you change your body language, the minute you don't quote-unquote suck up to the intensive care team, and the minute you don't put them on a pedestal, something 99% of families of critically ill patients in intensive care do, with the result that the intensive care team is doing what they want anyway. But if you keep doing what I've just told you, that's the minute when you know you have peace of mind, control, power and influence. That's also the minute the intensive care team realizes that they are dealing with a powerful family who's not playing their game or playing the game the intensive care team wants them to play. That's how you get an unfair advantage, by being different, by questioning things, by doing your own research and by not taking everything for face value the intensive care team is telling you. So, how exactly can you get an unfair advantage, and how can you quickly get peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.